you've done everything. You've conveyed irrelevance to these random, intrusive, mechanistic thoughts and feelings. You feel that you have a stranglehold on this condition. And there may be a lot of time of dormancy. I know we talked about the volcano analogy, how a volcano can be dormant for many years and then all of a sudden erupt. When that eruption, quote unquote, that metaphorical eruption happens, AKA relapses, what have you found? Because I know for me and millions of other people, it feels like, well, I did everything right. I already put this to bed. I was super confident that I had a stranglehold on this condition. Why is this happening? Why is it coming back? And why is it coming back in some instances, Doc, seemingly with just a magnified force? What have you found in your 30 plus years of dealing with this and guiding people with this? What have you found are the best kind of offerings to help with this?
So interesting is even in your phrasing to say having a stranglehold on OCD. That is probably the foundation of the problem, Nez. We're dealing with a system in the brain that we do not have any control over. And unfortunately, many people seek therapy in order to achieve control over a malfunctioning system that obviously creates an incredibly disruptive mirage or illusion of a crisis or a catastrophe. And when you apply therapeutic principles in a very aggressive way and demonstrate to the brain through aggressive exposure therapy and permission giving, the brain's design biologically is to let go of its need to warn through both the experiential element of OCD, which is an incredibly captivating sense of distress and emergency crisis, in addition to these thoughts that seem to be inappropriate, problematic, catastrophic. And so it's funny, just this past week, a patient who had worked with me somewhat briefly achieved some immediate therapeutic success and symptomology remediation. Her condition took a very much back seat. And she was talking to the group this past Friday, and she was saying, when we first met, the therapy really worked very well. And now it's sort of come back. And immediately I recognized what her problem was. And it's similar to what you just said about, I had a stranglehold, right? The idea of control. The illusion of therapy to gain control over our brain's activity, both in terms of cognitions, the thoughts, and in terms of the experience of distress. These are two things that are independent systems, which I speak about in some detail in my Choice article, that we do not want to try to control independent systems, because there's a tremendous amount of paradox in working with anxiety in particular, in terms of the more we try to control it, the more our brain is designed to demonstrate sort of a lack of control. So your stranglehold illusion and this patient's sense of whenever I hear a patient said, oh, the therapy's working, or the therapy stopped working,
yeah,
I immediately know that there's a problem in the patient's perception of what the actual treatment involves and what the goal of the treatment is. So, I say this over and over again. See, the goal of treatment is not symptom relief.
Mm.
The dividend of the treatment is symptom relief. The goal of the treatment is conveying irrelevance. And so a person can do very well with the therapy, and the condition can go into remission or dormancy for months. I've had patients reach out to me after years of it being completely dormant. And what can happen is that the amygdala can start misfiring again. And whether it reactivates an old theme or even regerminates a new theme, patients reach out often in a sense of panic. It's back.
Yeah.
And they're distressed, and because they've had so much success prior, years ago, months ago, in the condition going into dormancy, the symptoms in relief, remission, they become desperate to reestablish the non-existence of the condition's presentation of symptoms, thoughts, and anxiety. And in my choice article, I refer to this as chasing the dragon. The idea that having initial success, having initial symptom relief, getting one's life back is so rewarding and so meaningful, that when the brain reactivates its symptoms of distress, a person's natural instinct is to shut it off again. And that desperation to control the symptoms becomes the exact problem of what turns into a representation to the brain that the symptoms are a problem, they shouldn't be there, rather than a person who really has acquired the therapeutic skills understands that the symptoms are irrelevant. Feeling distressed or having these intrusive thoughts are not the problem. That it's the way one reacts and manages the symptoms that is the problem, and that by reenacting the processes that created the success of irrelevance is really the called for therapeutic paradigm and choices to be made.
Yeah, and I'm gonna link, as I always do. It's the to me, this is why I appreciate Doc being here. The greatest literature on this condition, which is the choice article by Dr. Stephen Phillipson, with us here today. I'm going to link all that below in the show notes description and pinned comment, and it's completely free and it's fantastic. It's a read.
Yeah, I'll just say this, that the choice article was a decision I made to take 30 years of practice as a specialist with OCD, and to take my 30 years of knowledge and condense it into a 47-page single-space article. My patients sometimes call it a book. But I decided I wanted people to know what are the variables in therapy that contribute to success, and what are the variables in therapy that contribute to treatment, either failure or prolonged treatment process. And I'm happy to say that even though the article is written focused on treatment success with OCD, there's a tremendous amount of information in it, just in terms of living life. I've had a few patients say, ironically, that they're appreciative that they developed OCD, and I'm never not surprised to hear them say that. And they say, because I developed OCD and I was able to acquire the skills within this therapy, so much of my life has been improved in terms of just living it with so many different variables, that the quality of their life outside of OCD has improved significantly also.
I could not agree with that more. I feel like, and I've kind of had this thought before too, Doc, in the past, that, man, if I can lick this, I can lick anything. And I know that's not the right approach, licking it or getting rid of it, what have you. Again, understand, man, Right, exactly. But I've tied it to so many other things that I love in life, like the Stoics and poetry and Taoism and Buddhism. I've tied it to so many other philosophies, like even Walt Whitman's Song of Myself. This idea of universality, and even David Lynch. I saw a video last night. David Lynch talking about transcendental meditation, and there's this ocean of consciousness underneath that we're always on the surface, but you got to get deeper. I think the choice kind of forces the reader and viewer to go deeper, and that's what I love about it. And it's 47 pages, and I've joked it's a novella, but I've read it all the way through, probably now maybe 8 or 10 times. But I've read, and I've said this before, I've read segments of it over and over again, probably 1,000 times, if not more. But it's not a panacea. It's not to be used as a panacea. And we'll come to that in a second.